Okay, good afternoon, everybody. Where's the rest of the class? Oh my gosh. Okay, well, good afternoon. Happy Monday. Today marks what would have been the 51st anniversary of Roe v. Wade, a ruling from the Supreme Court that recognized a woman's constitutional right to make deeply personal health care decisions free from the interference of politicians. But then the Supreme Court ruled to take that constitutional right away. The aftermath has been devastating. Women's health and lives now hang in the balance. Today, 21 states have abortion bans in effect. 27 million women of reproductive age live in states with bans. That's more than 1 in 3 women. Over 380 state bills restricting access to abortion care were introduced just last year. And on Capitol Hill, congressional Republicans have proposed 3 national abortion bans. The stories of women being denied care are gut-wrenching. In Texas, a woman was forced to go to court to ask permission to receive the care her doctor recommended before she ultimately fled Texas to receive the care she desperately needed. And she's not alone. We've seen one harrowing story after another of women who are experiencing a miscarriage and are turned away from emergency rooms, then later nearly dying because of that. This should never happen in America, never. But here's the reality. The overturning of Roe v. Wade has led to the chaos and confusion we're seeing play out across the country. And it's exactly why President Biden will continue to fight back and urge Congress to restore the protections of Roe v. Wade back into federal law. The health and lives of women are on the line here. So in about an hour, you will hear directly from the President on this, who will convene a meeting with the Task Force on Reproductive Health Care, while Vice President Harris today kicks off her Reproductive Freedoms Tour in Wisconsin. And with that, as you can see to my right, I'm grateful to welcome Jen Klein, the Director of the White House Gender Policy Council, back in the briefing room, and she will talk about our actions that we're taking today. Jen?
Thank you, Karine. As Karine said, and as President Biden has made clear, since the day of the court's decision to overturn Roe, Congress must pass a federal law restoring the protections of Roe. And in the meantime, the Biden-Harris administration will continue to fight to protect access to reproductive health care. Since the Supreme Court overturned Roe v. Wade, the administration has taken action to help ensure that women receive the care they need in an emergency, to protect access to safe and effective medication abortion, to defend the right to travel for medical care, to expand access to contraception, affordable contraception, to strengthen privacy protections for patients and doctors, to support access to reproductive health care for service members and veterans, and to partner with state leaders who really are on the front lines of protecting reproductive freedom. To coordinate this work across the federal government, the President established a task force on reproductive health care access, which I chair alongside HHS Secretary Becerra. And today, as you heard, as we mark what should have been the 51st anniversary of Roe v. Wade, President Biden will convene the 4th meeting of that task force with agency leaders. The task force will hear directly from 2 physicians who are on the front lines of the fallout from the overturning of Roe v. Wade, and who will share their on-the-ground experiences of how state abortion bans have wreaked havoc on their patients and interfered with their ability to practice medicine. The President will then receive updates from his task force on efforts to protect access to reproductive health care and the continued threats to emergency care and FDA-approved medication abortion. Task force members will also report on new policy actions the administration is taking to strengthen access to reproductive care. While the President is convening his cabinet, the Vice President is in Wisconsin, a state where Republican elected officials want to enforce an extreme abortion ban from 1849. That's before women had the right to vote. That includes no exceptions, including in cases of rape or incest. As you heard from Karine, she'll kick off her Fight for Reproductive Freedoms tour, and she'll be hearing and listening to women and healthcare providers about the devastating impact of state abortion bans. And with that, I am happy to take some questions.
I'm just wondering how much more new action the White House believes it can take between now and November on this front, or do you mostly expect that the actions and announcements that are to come will be, expansions on actions we've already seen since the Supreme Court took action?
Yeah, I mean, as the president has been quite clear since Roe was overturned, the ultimate solution is to pass federal national legislation to restore the protections in Roe. And we will continue to work to hope that Congress will pass that legislation so the president can sign it. He has also been clear literally since day one of when the decision came down in Dobbs that we will do everything we can. So that's why he's issued 3 executive orders and 1 presidential memorandum. The executive orders are on strengthening access to abortion and contraception, on protecting patient privacy, on protecting patient safety and security, on protecting access to emergency care, and defending the right to travel. And we will take actions in all of those areas. We have already, and we will continue to. So to your question, is there anything left to do? I think the answer is yes. And today, when the president convenes his task force, you will see actions in a few more areas. They do build on the executive orders that he has already released. So just to outline what a little bit more about what those policy actions today will be. First on contraception. There will be new guidance to support expanded coverage of a broader range of contraceptives at no cost under the ACA. The Secretary of Health and Human Services will also issue a letter to private insurers, state Medicaid programs, and Medicare to reinforce their obligations to cover affordable contraception. On emergency care, HHS will be announcing a comprehensive plan to educate patients about their rights under the Emergency Medical Treatment and Labor Act, known as EMTALA, and the process for filing a complaint, and also disseminate training materials for healthcare providers, convene those providers to ensure that they know how to comply with EMTALA, and also establish an expert team at HHS to help hospitals and healthcare providers comply with those legal obligations under EMTALA. And last piece is we will take additional steps to implement the presidential memorandum on medication abortion to protect the safety and security of patients, providers, and pharmacies who need, prescribe, or dispense medication abortion.
And could you just talk to us a little bit about how the White House is viewing ballot initiatives heading into November, the importance of them, what the landscape is?
Yeah, I think the series of ballot initiatives, most recently in Ohio, but also in Kansas, Kentucky, Michigan, Montana, Vermont, California, really show how salient this issue is and how every time Americans are given the opportunity to make their voices heard, they make their voices heard very loudly and clearly in favor of reproductive freedom. And there are more ballot initiatives coming, and we will do everything we can to support state leaders, as I said, on the ground who are really on the front lines.
Thank you.